Hello, my name is John Durr, and I'll be giving a brief presentation on the role of the hospice nurse. The primary function of a role in a hospice setting is to provide compassionate, skilled end-of-life care for a patient. And that does not stop with the patient alone. Rather, it also extends to any family or perhaps even friends during that time of their life. Things are winding down. The goal is to prepare the patient and all of their friends and family for the eventual passing of the patient. Now, as the care is not just centered on the patient alone, there are ways that the hospice nurse addresses both the patient and the family. For an individual, while they're not going to be doing any treatments or any life-saving measures to try and cope with a ongoing chronic or progressive disease, they will be managing the symptoms of the patient, taking care of their pain, making sure they're able to eat, making sure they're comfortable, even things like managing opioid-induced constipation during their end-of-life care. Obviously, the patient will need to be educated on things as far as what to expect. If they're cognitively sound, you give them cognitive appropriate teaching to ensure that they know what to expect and they know how things are going to proceed. Most of that stuff they should get whenever they enter the hospice program. Another big thing is to preserve the dignity. Somebody in end-of-life care is going to be very emotionally vulnerable. Perhaps they're very afraid, very alone. Mayhaps they've not come to peace with this eventuality yet. It is important that a hospice nurse preserves the dignity of that patient. Further, any cultural values or spiritual expression, it's the hospice nurse's duty to accommodate that and allow for that, regardless of their personal feelings on the matter. Regarding the family, hospice nurses provide some of the same things. So they don't have any physiological symptoms or anything like that you're going to be addressing. They still need to be comforted and educated and prepared just the same. Now, teaching strategies implemented by hospital nurses, they have to be fairly delicate. They have to kind of gauge, a way they can do that is to gauge the expectations of both the patient and the family beforehand. See what their thoughts are. You kind of want to see what they believe and what they expect is going to happen. You want to listen and ascertain any kind of spiritual beliefs and cultural concerns that may be that they may embrace, that you need to accommodate for. Listening and evaluating, there may be family members of all ages. There's a lot of information out there for hospice nurses. For example, regarding children of different ages, it's important to explain and talk to these family members at a age-appropriate level, so that you're not causing any undue duress or any misunderstanding on the part of children. Also, when teaching, you need to make sure that you're not attempting to teach when it's emotionally not viable for the patient or the family. You kind of have to feel the room and understand when they're going to be able to learn best, probably comfort them sometimes, and educate later. Then if they have any misunderstandings, obviously you need to clarify things and kind of evaluate, and if they're unclear about parts, may have to go over some of those things or explain some concepts to them. Now, as far as individualized teaching, every family member could be different. You could have some family members that are more peaceful and accepting of this period of their loved one's life. You may have others that are not. There could be individual barriers. There could be cultural language barriers, sensory deficits in the case of perhaps hard of hearing or blind patients or family members. Those things obviously need to be accounted for, as well as need to kind of ascertain the educational level. You don't want to go over the head of anybody and come off as insulting during this troubling time. It's also important to choose the place and time. Whenever you're providing the education to both the patient and the family member, you want to kind of make sure you're removed from distractions. And if you have somebody that is very emotionally volatile and somebody that is very stoic and not perturbed by the passing of their loved one, you may need to separate them to educate them individually, as it were. And again, you want to kind of continually evaluate the continued ability of them to receive any education that you're giving, and making sure that they're understanding everything that you're touching on. To become a hospice nurse starts off the same way as most other nurses. You go to school and get your associates or your bachelor's in nursing, and you pass your NCLEX. For hospice in particular, most facilities require you to have around 2 years, at least 2 years of related experience. And there is a hospice and palliative nurses certification exam further that you have to pass after that, and then you get your CHPN. Now, there are some related disciplines or other types of nursing that may play more closely with hospice nurses than some other specialties. For example, hospice can be performed in a facility or on a home health basis. There's a lot of home health nurses. There's a lot of overlap there, but also as far as the originations of both hospice and home health. Gerontology is just pretty obvious. And oncology, there are a lot of, when patients become, have neoplastic processes, then they become terminal. They feed into hospice fairly often. Oops. Now, in addition to the certified, the tests and the state or federally required things, there are skills and abilities that hospice nurses should be versed in. Any kind of pain management experience is going to be useful, particularly being able to, you want to be well versed in all the different types of pain scales. Your hospice patients might not be verbal, and you need to pick up cues from the patient as far as when they're in pain, is the ability to gauge that pain without any kind of verbal response, things like that, as well as familiar with the signs and symptoms of over-medicating. So you can't go in too heavy-handed either. Just really want to go in there and alleviate the pain without causing any undue side effects. Empathy should probably be the first bullet point in this section, because in addition to the patient coming to terms with the end of their own life, you often have family members of the patients as well. You need to be able to empathize with the patient and their family and just comfort them as best as you can, and try and understand what they're feeling. A good disposition will definitely help a hospice nurse. It is important that you be able to be cheery when appropriate, and solemn and stoic when appropriate, and comforting when appropriate as well. It seems like it would be very easy for a hospice nurse to get burned out, so much like social workers, other people in that field, self-care is of critically high importance for the hospice nurse. A couple of things of interest while looking this information up. I found the work of Elizabeth Kubler-Ross, who also did the 5 stages of grief. Wrote a book called On Death and Dying that she was kind of instrumental in changing the way that people looked at end-of-life care. I learned of Dame Cicely Saunders, who opened a hospice facility in England in the, I believe, 60s, and was one of the first types of facilities like that were addressing the end-of-life care, particularly of patients. Here are my references. They'll be in the end of the PowerPoint. Thank you very much for your attention.